And we are back. Joining us, the National Urban League's Mark Morial, the House Republican Whip, Congressman Eric Cantor of Virginia, and House Democratic Chief Deputy Whip, Congresswoman Debbie Wasserman Schultz of Florida, plus two Washington journalists, Ron Brownstein of the National Journal and Katty Kay of BBC World News America, plus two minor league round draft picks to be named later. We have our own healthcare summit here. We have a big group. Welcome to everybody. Congressman Cantor, let me begin with you. The big question is, where are we after this summit, after all the machinations and negotiations? Are there the votes in the House to get this done?
Well, I'm sure my colleague will have something to say about that. But, David, there's a reason why we're here with no health care bill having been passed. And that's because the American people have decided this is not the health care bill for them. And that's why you heard during the 7-hour discussion that we had at the Blair House with the President, Republicans come to the table and say, look, we do care about health care, and we want to do something to affect positive reform. It's just that we want to take a much more common sense, modest, incremental approach, trying to address the first issue first, which is cost, and then go on to try and deal with some of the things that the President and Speaker Pelosi want to do.
All right, we'll come back to that, but in terms of what the general approach is. But Congresswoman Schultz, are there the votes in the House, which is really the big testing ground here, if it's reconciliation, for instance, where you go for a simple majority? Are the votes there?
When we start counting, the votes will be there, because the American people want to make sure that we take the abusive practices that the insurance companies engage in and make sure that we put doctors and patients back in the driver's seat. Right now, it's insurance companies that decide what kind of coverage you have. Right now, it's insurance companies that can drop you based on a pre-existing condition. I know that from personal experience. Right now, you can get dropped when you become sick. We've got to make sure that we put doctors and patients, not insurance companies, back in the driver's seat. And if you look at the polling, if we're going to talk about polling, that the American people have weighed in on, they support the components that are included in this bill because they want to make sure that we end abusive practices by insurance companies.
But Mark Morial, the composite of all of those, the difficulty that the President faces, is that he has not sold the public on his version of health care reform. That's the reality of his situation right now. I spoke to one very close ally of the President's on this fight, saying he thinks 40% chance this ultimately gets done. Where are we?
I think that there's a strong chance that it's going to happen because it needs to happen, because beyond the politics of Washington and the infighting, the fact of the matter is there's a problem in this nation, and that is there are many people uncovered, and for those who do have coverage, costs are exploding. So I think that the President rightfully went back and had a discussion which was a health care summit. Some may have said it didn't make good TV, but what it did is it showed that the discussions are substantive, that the issues in fact are serious, and I think at the end something should get done and something will get done because it needs to get done.
You know, it's interesting, Ron Brownstein and our congressmen and women will talk about some of the philosophical differences. For all the talk of the petty politics, one thing that came through the summit is that there are very big philosophical and ideological divisions about the role of government in the healthcare system and how many people should be covered, particularly given the finances during a recession.
Absolutely. I mean, I think one of the real points that came out of the summit was the depth of the disagreement between the parties. And in fact, each party's health care plan, I think, largely crystallizes their view of the role of government. And they differ not only in their solution to the problem, but their definition of the problem. I mean, we're not really, to use the President's term, comparing apples to apples. The President's plan, the Democratic plan, attempts to cover, roughly by the CBO estimate, 33 million people who are uninsured over the next decade. The Republican plan, by the CBO estimate, aims to cover 3 million people. It is a much more minimalist plan. It's basically recycling ideas, the association health plans, the interstate sale of insurance, the medical malpractice that Republicans pushed and were unable to bring into law when they held unified control of the House and the Senate and the White House in the middle part of this decade. They were unable to build enough public consensus for those ideas when they had unified control to get them into law. So, I mean, I think what we're seeing here, the reality is healthcare is a very difficult issue. It has defeated every president who has tried it for 70 years. It's a very complex problem. And what you're seeing in the end are fundamentally different visions of the parties about how to attack this and really what even you are attacking in the end.
What about the President's leadership on this, Katty?
I don't think that the summit changed things either way in terms of the potential for passage or not passage of this reform bill. And I want one area where I think the President hasn't managed to try to get those poll numbers to shift in favor of reform is to say to Americans, listen, you may have a level of care at the moment that you're happy with, but if we carry on with these exploding costs, care will deteriorate. At the moment, America has globally the 37th highest quality of care in the world. That puts it just above Cuba, just below Costa Rica. Now, is that where America sees itself in terms of its quality of care? And that number will decline. It's going to slip down the global pole of where its level of healthcare is if something isn't done about healthcare reform. And that's an argument that the president hasn't managed to get across. I think the other thing he hasn't done is really appeal to a sense of generosity in the American people. I travel around the country and I've seen the poll numbers, but I'm struck by how many Americans say to me, we don't see ourselves as a country that doesn't allow people access to a doctor if they don't have insurance. That's just not how Americans see themselves. This is the country that gives the highest level of charitable donations in the world. Americans think of themselves as a different country than that.
And yet, all of you can weigh in on this. The tension seems to be that individual elements are popular. You can talk to people who want better health care, better access to health care, reform. But there's a lot of distrust that government can deliver this kind of care and handle it well. Isn't that the fundamental tension?
The fundamental delivery system here will be the private insurance system. That's what's key. This is not the government running insurance. It is changes to how health care is delivered. But what it would do would be to provide opportunities for more Americans to purchase private insurance. And I think there's been a great deal of confusion. This is, in essence, a partnership between the government and the private sector to expand health coverage. And I think that it's been confused by talking points. It's been confused by political broadsides, but that's essentially what it is.
David, the reality is, and take a little bit of different approach here and difference with that statement, the reality is Republicans do care about health care. We want to address the first and most foundational element, which is cost. Because if we can bring down costs, more people can access care. But we also know that there is something we need to do to get more people uninsured. The problem is with the president's bill, it's about expanding Medicaid. No one wants to go on to Medicaid. That's why physicians in Florida and other states are leaving Medicaid in droves because of the imperfect reimbursement structure. That's what this bill is about, is expanding the government programs that don't work. We need real reform to bring down costs.
David, you want to talk about bringing down costs. Our bill makes sure that we address the problem of every family in America having a $1,000 hidden tax for covering the uninsured. There's 47 million people in America that don't have insurance, and we are all paying for them because they show up at the emergency room as their primary access point for health care. In order to reduce costs, we can cut a tax of $1,000 on American families just by covering those people. We can also make sure that we bring down costs by broadening the pool, adding the healthiest people who are choosing right now to not carry health insurance, and then when they get hit out of the clear blue sky by an unexpected illness, they don't have insurance, and we're all paying for it.
But let's reality check this for a second, Ron. The claim by Congressman Cantor that there isn't cost reduction here. We're not lowering costs. Is that accurate? Look what the CBO says about the effect on the deficit.
There are two ways to look at this. The CBO says that the Democratic plan would reduce the deficit. Republicans believe that many of the changes in Medicare would not be implemented in the long run and call that into question. The broader question of what it means to overall national health care spending has been analyzed by the Medicare actuary, which is an independent position. And what they concluded was that between now and 2019, if you did the Democratic plan, you would insure 33 million more people, and total national health spending would increase by less than a penny on the dollar. So does it break the back of rising costs? No. But does it reallocate resources within the medical system more efficiently, potentially, than they are now? Clearly, the actuary is suggesting, yes, if you can cover 33 million more people at a total cost of less than a penny on the dollar increase in our total national health expenditures, that is a part of the debate that has not come through. Can I go back to your point, though, very quickly, which was, you're absolutely right. Even though individual elements of this plan do poll well, overall, Democrats have never been able to get into a position where most Americans, particularly most white Americans, because there is a difference between minorities and whites in the polling, believe it will help them and their family. That's why this is, I think, a real gut check moment for these Democratic majorities. I think if you poll them privately, clear majorities in both chambers will believe they have produced a plan that is a reasonable way to approach universal coverage if that is your goal. The question is, do they believe they can sell it to the American people if they go forward with it? Because, as you say, right now, they haven't. And Republicans, I think, exuded confidence at that summit that they believe they are winning this argument.
So, Congressman, what happens between now and the point at which you say you have the votes? What is the president going to say this week? How will he justify reconciliation going for a simple majority in a way that a congresswoman other than yourself, who presumably can cast a vote for this safely in her district, how do other members of Congress go back and say, no, this is a good thing, we're going to do this?
Because the American people support the pieces of this plan, and after Thursday, they see through the Republican mantra that we need to start over. Start over means do nothing. I mean, make no mistake about it, it's disingenuous for my colleagues to suggest that they really want to cover people when the only thing they've got out there covers 3 million people. Nothing in their plan would bring down costs. We have the largest tax cut for small businesses and people who pay for health care in our bill in American history. And that's the bottom line. We have cost reduction, we have comprehensive coverage, we cover 31 million people, and they don't even come close.
Congressman Cantor, let me revise that by asking this. What specifically, you have the bill piled up in front of you, what can you say yes to that's in the president's revised proposal? Anything?
We can, listen, Dave, let's take a step back for a second, because this notion that somehow Republicans never came forward with solutions, I think the American people are over that now.
Well, but hold on, but what you said specifically is there is a big difference in scope, 30 million covered versus 3 million covered, difference in the role of government. We established that.
What we say is this, our approach is an incremental approach. It is not do nothing. I think that's a tired argument.
Do very little.
It's an incremental approach. Let's talk about doing the first thing, which is bringing down health care costs. That's how this whole debate began over a year ago at the White House when the president had his first summit. Then we go about trying to do the kind of things. Well, we certainly, the CBO has validated that we bring down health care insurance premiums without a doubt. So that helps folks who have it, and we can expand coverage. We also say, look, we don't approve of denial of coverage for pre-existing conditions. We have a plan. Absolutely, it's in our bill. We have a plan that creates universal access programs at the state level, which allows folks to access insurance if they're denied by their insurer. David, let me just bring
quickly respond to anything there that you think should
well, no. In fact, CBO has estimated that both plans, both the Democratic plan and the Republican plan, if you're looking at existing insurance, your existing insurance plan, would bring down premiums by about the same amount for the apples to apples. CBO says roughly for the Republicans 5 to 8, roughly 7 to 10% for Democrats on the effect on the same plan. Now, the reason why the cost goes up, and this is a question I think Democrats are going to have to answer as they go forward on this, is that they are mandating a richer plan than in some cases people, a more comprehensive plan than people now have as the baseline in these exchanges. So one of the questions I think Democrats may be asking themselves is, can they bring down the cost of this somewhat by moving back away from some of those mandates? But if you look at the CBO analysis of both kind of core proposals in terms of their impact on insurance premiums, it's very similar.
Hold on, let me get Kat in here for a second on this question too of what are Republicans saying yes to, which goes to the overall question is the politics for Republicans here. What's it worth to them to have any sort of reform or not to?
Well, it seems to me at the moment the politics of the Republicans is to carry on saying no. I don't see where the value for the Republicans politically is to signing up pretty much to anything. They do believe that they have public opinion on their side on this, and they will be able in November, if health care doesn't pass, to turn to the public and say, look, the White House was expending an awful lot of energy on trying to get the president's signature bill through when what he should have been concentrating on was jobs, jobs in the economy. And you can see the Republican ads being written at the moment if this bill isn't passed and if it's not successful.
Here's what the people deserve. They deserve an up or down vote. And not a lot of procedural delay tactics, the use of all sorts of measures. The people deserve an up or down vote on health care. Let everyone put their proposals on the table. Let the House of Representatives and the Senate vote it up or down.
I think
let me weigh in this. Let me just weigh in right now, because I'll tell you one thing. If Speaker Pelosi rams through this bill through the House using the reconciliation process,
just like
they will lose.
Simple majority vote.
Hold on, one at a time.
They will lose their majority in Congress in November.
Hold on, I want to just follow the issue of reconciliation.